for this new set of guidelines on stable angina for the diagnosis, it's very important. We have changed the table to calculate the pre-test probability of the patients to have stable angina on the basis of age, gender, and symptoms, type of symptoms. According to this probability, we can pick the test for the diagnosis, and we encourage the physicians to do stress imaging.
The two major novelties in these guidelines are firstly a completely different way to consider the diagnosis in terms of diagnostic strategies, but also in terms of entities, because now we distinguish with some new entities of stable CAD, including the patient without stenotic lesion or with spasm, for instance. And also for the treatment, strategies have been simplified with only two lines of treatments. First line treatments being the beta blockers and calcium channel blockers, and second line treatment being other anti-ischemic drugs. And in addition, you will have the drugs for event prevention like aspirin, statins, and ACE inhibitors in some subgroups of patients.
Clarify is a large international observational registry of patients with stable outpatients with coronary artery disease. It's more than 33,000 patients in 45 countries.
At the 3-year follow-up stage, Clarify investigators measured and compared the outcomes of stable CAD patients, whether they had no ischemia or angina, ischemia alone, angina alone, or angina and ischemia.
The first result which struck us is that the majority of patients have neither angina nor ischemia, approximately 60% of the patients. Patients who have an ischemia alone have no different outcomes. They have similar outcomes. However, patients who have angina, particularly if they have angina and ischemia, are the patients who are worse off. So it seems that the crucial feature is not so much having ischemia, but having anginal symptoms. That is associated with a worse outcome. So there's more to be seen in this area, but really, even if a patient is doing well, we should be very aggressive with secondary prevention measures, and anginal symptoms are a very bad omen in patients with stable CAD.
ESC Congress 365 is your free access to ESC Congress content all year long.